Hello everybody, today's topic is a very shaky one, Parkinson's disease, a chronic degenerative disorder that affects movement and other cognitive impairments. Not wasting much time, let's take a look at our medical mnemonic. Parkinson's is a degenerative disease that affects the basal ganglia, which plays a crucial role in motor control. The major function of the basal ganglia is the ability to initiate movement, and after the movement is initiated, then the cerebellum takes over and makes sure that the movement is executed accurately. The basal ganglia comprises of a direct and indirect pathway, and Parkinson's disease affects the direct pathway. In other words, there is an imbalance between dopaminergic neuron activity and cholinergic activity. Cholinergic activity in this case is greater than dopaminergic activity. In the meantime, let's take a quick look at a gist of some basic anatomy of the basal ganglia. Alright, so here we have the motor cortex, and the motor cortex generates the impulse that is necessary for an intended body movement. Once that signals are generated, the basal ganglia takes over and makes sure that the movement is initiated. There are also two structures that are very similar, both functionally and histologically, except that they are divided by the internal capsule right here. This is the caudate nucleus and the putamen. Together, they are called the striatum. We also see a little bit medial to the putamen, the globus pallidus. This has an internal segment as well as an external segment. We can see the substantia nigra, a very important part because this is where dopamines are produced, and this neurotransmitter is used in driving the direct pathway. The direct pathway extends all the way to the thalamus right here. And inside the thalamus, there are motor nuclei, and this helps to project or relay back the information to the motor cortex so that the intended movement can then be executed. The subthalamic area is also very important for the indirect pathway. So essentially, the major components of the basal ganglia includes these structures that we have just seen. Now, this inhibition phenomenon is where two neurons gets inhibited, but then results in an overall excitation of a third neuron. So we have one GABA neuron that gets inhibited, that then inhibits the second population of GABA neurons, but that would excite a third neuron. This is what we mean by this inhibition phenomenon. All right, so here we're looking at both pathways, and we can see the direct pathway on the left, and we can also see the indirect pathway on the right. Both of them are driven by the motor cortex. So there is a motor cortex excitation, which is propagated onto the striatum. You do recall that the striatum is simply made up of the caudate nucleus and the putamen. There is also a cholinergic activity in the striatum. This is where the disinhibition phenomenon comes in. So we have the first group of GABA neurons, GABA substance P. These neurons would inhibit a second group of neurons in the globus pallidus internal segment. These GABA neurons in the internal segment will then excite the thalamus. There are motor nuclei in the thalamus that gets excited. So the substantia nigra produces dopamine, and dopamine is able to exhibit a positive effect or stimulate these D1 receptors, and D1 receptors would potentiate the direct pathway. In other words, D1 would make the disinhibition phenomenon more effective. The conclusion is that the thalamus would now get excited, and that can then be projected or propagated back to the motor cortex, and the exact movement can then be initiated. The indirect pathway is also driven by the motor cortex, and that excitation is propagated onto the striatum. There is a cholinergic activity in the striatum. Now recall the disinhibition phenomenon, where there is an inhibition of a first group of neurons. Here it's GABA and enkephalin. These neurons would also inhibit a second group of neurons in the globus pallidus external segment. These GABA neurons would then excite the subthalamus. Their activity or their excitation of the subthalamus is then used to suppress the motor activity of the thalamus. Now, you do recall that in the direct pathway, the thalamus rather got activated and it projected back to the motor cortex. So the indirect pathway inhibits the thalamus through these GABA neurons right here in the direct pathway. Dopamine also inhibits the indirect pathway through D2 receptors. So by stimulating these D2 receptors, they are able to inhibit these GABA enkephalin neurons and they are able to abort the disinhibition phenomenon. But recall that the D1 receptors are rather used to enhance the disinhibition phenomenon so that the thalamus would become activated. So D1 receptors are for direct pathway and D2 receptors are for inhibition of the indirect pathway. Direct pathway and indirect pathway normally function parallel to each other, but in Parkinson's disease, there is a decline in the direct pathway, whilst there is an activated indirect pathway. So there is an imbalance. Now, during the treatment of Parkinson's disease, we can say that we would probably have to potentiate or increase the activity of the dopamine or increase the activity of the direct pathway, whilst we decrease the activities of the indirect pathway. Alright, so let's take a closer look at how dopamine inhibits the indirect pathway. And I want you to recall from the disinhibition phenomenon, which is simply one GABA neurons gets inhibited, those neurons would inhibit a second neuron, and the second neuron would excite a third neuron. So in the indirect pathway, we are seeing the first population of GABA enkephalin neurons, they get inhibited. They are then transmitted into the globus pallidus external segment. In here, there is also GABA neurons. These GABA neurons are also inhibited, and those GABA neurons will then transmit this into the subthalamus, which will become excited. Okay, this is how the indirect pathway works. Now, on the other hand, we can say that the direct pathway, when active, would be projected into the thalamus. Usually, the thalamic motor nuclei becomes activated in the direct pathway so that the exact movement that we want to initiate can occur. It all starts with a motor activity in the thalamus. Now, when the indirect pathway reaches the subthalamus where there is an excitement, that excitement can be used to inhibit the motor neurons in the thalamus. So we can say that the indirect pathway inhibits the direct pathway. So how does dopamine inhibit the indirect pathway? So dopamine uses its D2 receptors to prevent that disinhibition phenomenon. In other words, recall disinhibition is when this gets inhibited, then this gets inhibited, then this gets excited. So dopamine will prevent that through its D2 receptors. On the other hand, there is also M3 muscarinic receptors in the striatum. So cholinergic activity can lead to excitation or stimulation of M3 receptors. M3 receptors, when active, would rather be in contrast, that is, work against dopamine. It would rather potentiate the disinhibition phenomenon. In other words, this will get inhibited, this will get inhibited, and this will now get active. This is how it works, and that's how dopamine would exhibit its inhibitory effect in the direct pathway. So the treatment of Parkinson is to try to minimize the effect of these M3 receptors, to decrease the cholinergic activity, and to increase dopaminergic activity. So Parkinson's disease affects the direct pathway and the clinical features are bilateral because it is a degenerative disease. The motor cortex is underactive because of a low dopamine input and an overactive indirect pathway. So one would also expect to have tremor, whether the problem is a direct or indirect impairment. However, the tremor of Parkinson's disease is usually at rest and a pill rolling like tremor, which is in contrast to cerebellar disorders in which the tremors are usually intentional. Medications may also worsen the tremor in Parkinson's disease. Hypokinesia or bradykinesia simply refers to the slow movements that are seen in Parkinson's disease. Cogwheel rigidity is the muscular stiffness or the cogwheel jerks that are felt when you apply movement of passive extension or flexion. This type of muscle tone gives in little by little, hence the term cogwheel rigidity. Patients with Parkinson's disease are not able to maintain balance under static or dynamic situations. For example, difficulty with starting the movement or maintaining a static movement when in the upright position. Parkinson's disease affects some autonomic ganglia as well as some ganglia in the hypothalamus. This may lead to bladder impairment, such as lower urinary tract symptoms. Bowels may be affected, constipation or fecal incontinence, hypersalivation, drooling, or even choking. Hypertension, if very severe, then you must exclude atypical Parkinson's, such as multiple system atrophy. Sweating excessively may also be seen, and temperature dysregulation in the body. Among the neuropsychiatric impairments that are seen with Parkinson's disease may include speech problems, dementia, mood, depression, behavioral or personality changes, psychosis, or even insomnia. Thank you, and I hope this was useful. If you enjoyed it, then hit the like button and subscribe to the channel. Bye.